Okay, we're going to continue with our second part of lecture. Here I'm going to talk about the mechanism of injury for abdominal and pelvic trauma. For abdominal trauma. The first mechanism of injury is blunt. So in blunt, you have three types of injury. First is direct blow, second is shearing injuries, and third is deceleration injuries. Direct blow can happen when you have contact with the lower rim of a steering wheel or a bicycle or a motorcycle handlebars or an intruded door in a motor vehicle crash. So this can cause compression to the visceral or the bony part, and hence it causes crushing injuries. Okay, so when it happens to the solid organ, it can bleed, and when it happens to the hollow organ, it will contaminate and cause peritonitis. Shearing injuries, it can happen when you improperly wear the restraint device, or for example, you don't wear it in an optimal position. So sometimes we can call it as lap belt injury. Okay, so what happened? It will cause crush injury to the organ. For example, it will rupture the small bowel or the colon. As you can see here in the picture, there's a lap belt sign. Deceleration injury can happen in motor vehicle crash, can happen in a person who fall from a significant height, which can cause diversion movement of a fixed and also a mobile part of the body. Hence, it can happen to liver and spleen, which the liver and spleen can be lacerated, or it also sometimes there's injury that we call as a small bowel bucket handle injury. Okay, this small bowel bucket handle injury is a type of mesenteric injury of the intestine, which the intestine are separated from the mesentery and thus leaving a devascularized segment of bowel that looks like the handle of a bucket. Okay, so this can happen in the blunt trauma of the abdomen. So we go to the next mechanism of injury, which is the penetrating. So penetrating can happen in three ways. First is the stab wound plus low energy gunshot wound, and second is the high energy gunshot wound, and last is the blast. For stab wound and low energy gunshot wound, the mechanism of injury is by lacerating and tearing that can cause tissue damage, and this the injury happen to the abdominal structure that near to it by travel across or through the abdominal structure. For high energy gunshot wound, because it's high energy, so it can transfer more kinetic energy, hence it will increase the damage surrounding the tract of missile, and by doing this it can cause a temporary cavitation in the abdominal structure. Okay, so it also can cause additional intra-abdominal injury based on the trajectory, based on the cavitation effect, and based on the bullet fragmentation. Okay, the last mechanism of injury in penetrating is blast. So actually blast can cause lots of injury. We define it as primary, secondary, tertiary, quaternary, quinary, and also psychological trauma. So in primary, it can happen like shock wave or blast over pressure. Like for example, it can happen to the person who is close to a landmine and expose a landmine, which it can affect the injury to the ear, to the lungs, and to the hollow organs of GI tract. In secondary, it is caused by the fragmentation and objects propelled by the explosion. So it can injure any part of the body, and it also can cause penetrating injury with visible bleeding. And then in tertiary, explosion will cause displacements of air, which can throw the victim to a solid object, and this can cause a combination of blunt and penetrating injury. In quaternary is all the miscellaneous injury which is not in the primary, secondary, and tertiary injury. For example, flash burns, crush injury, and respiratory injury. So the fifth mechanism of quaternary, it can cause any illnesses or injuries or diseases by biological, chemical, or radiological substances. For example, such as dirty bombs. Okay, and the last is psychological trauma, which can cause post-traumatic stress disorder to the victims. So here are the list of organs involved in abdominal and pelvic trauma. As you can see, for blunt, the most affected organ is spleen, and in stab wound is liver, whereas in gunshot wound is the small bowel.